All right, class. So to continue our discussion on um, acute care nursing, we're going to look at stroke and some key stroke facts today. So stroke is the fifth leading killer in the United States. Kills on average 129,000 Americans every year. The number one cause of deaths in America is heart disease with over 614,000 deaths. Number two is cancer with over 590,000 deaths. Number three is respiratory illness or respiratory disease processes of the lower lungs, including kind of like your COPDs, um, your emphysemas, and chronic bronchitis with 147,000 deaths a year. Accidents or accidental deaths could be car accidents, could be work accidents. Unintentional deaths account for about 136,000 deaths. So stroke used to be the fourth leading killer, but with good prevention and medical intervention, we are slowly lowering that, which is a great thing. It's improving the lifestyle of America. So things to remember with stroke, time is brain. Now, what do I mean by that? Well, you'll hear occasionally that you have like a 4.5 hour window or 4.5 hours from the last well known time to provide interventions, which is true. That's what we want the public to understand. For us, however, in the healthcare field, we want to make sure it's less than 3 hours so we can start our interventions. 3 hours or less from the onset allows us to start TPA or that clot busting medication, which is going to help restore blood flow and reduce your recovery time and improve your patient outcomes. So, time is brain, right? One death every 4 minutes. That's what those statistics lead to. And every minute that we don't have blood flow back to the brain, we're losing 2 million brain cells or 2 million neurons every minute that goes by. So, what is stroke? Stroke is a brain attack. You can hear it called lots of different things, but brain attack is really what the new terminology is. It's when the brain's blood supply is interrupted, or it could be either the flow is blocked from a clot, from plaque buildup, or it could be from um, a blood vessel that has broken and is leaking blood into the surrounding brain tissue. What is that? What is that going to mean? Well, it means blood still is not getting to the brain, and it's filling up around the brain. So, 87% of all strokes are ischemic strokes. This means that there's no blood flow to one area of the brain. So, this would be your clot, plaque formations, um, something, it could be a clot in the arteries of the brain, or it could be down in the supply area to the brain. So, it could be down in your carotids. Um, So that means roughly 13% are hemorrhagic strokes. That's where the blood leaks out of the vessels. Um, Ischemic strokes, the more common form of stroke, is actually not painful. You might just not feel well. Go to lay down, you wake up, and all of a sudden your family members notice other things are going on. The ischemic or the hemorrhagic stroke, I'm sorry, the hemorrhagic strokes are the ones that you might hear someone describe. They had a sudden thunderclap headache. They're getting um, their neurologic status is starting to fall gradually. They might be getting sleepier. Um, these are a little bit more serious, but you need to get treatment immediately. And one other little fast fact here: 34% of all people hospitalized for stroke were under 64 years old, or under 65 years old, so 64 and below. That is an astonishing fact. This is why prevention is key. We have to start and continue. We've already started. We have to continue the progress we've made in preventing these strokes. So, what are the warning signs of stroke? So, your family member goes to bed and all of a sudden they wake up. the acronym FAST is kind of some of these warning signs for stroke. These are things that we can use and educate our patients and families on to look for signs of stroke. So facial droop. Can your loved one give you a smile? Can you smile? Is it equal? Is one side raising of your mouth raising and the other side's not? Arm drift. Now this sounds weird, but can you lift both arms? Or if someone's having a stroke, they feel like they're moving both arms, but it might only be one side that's able to lift, or is one going up and then kind of fades back off. Speech problems. Is it slurred? Is it jumbled? Are they able to speak at all? Do they understand you? You might hear this called fruit or word salad. It could be from a global aphasia. It might be an expressive aphasia, meaning they can't tell you what they can hear what you're asking them to do, but they can't get the words out. They're unable to speak. No matter what signs, if you have one of these signs, it's time to call 911. Remember, time is brain. Prevention is better. 80% of strokes are preventable. So some of these strokes, you might have what they call little mini strokes, or a TIA. That is a blockage in the blood vessel that lasts for only a minute. If you have coronary artery disease or atrial fibrillation, these could be causing these little TIAs or mini strokes, and they're just a precursor to the much bigger stroke that could be coming. So getting to see your doctor, that's where it's the most important. They can prevent these from happening. And obviously stop, and if you haven't started smoking, don't start smoking. This is not this seems very silly, but secondhand smoke and the effects of smoking are well known, and we don't need you don't need to be smoking to look cool or anything like that. It's going to cause a lot more risk factors for you. So we say prevention is better. So what are some of our modifiable risk factors? High blood pressure, high cholesterol, diabetes, heart disease, smoking, all these things we can work towards. We can improve our lifestyle. We can eat healthier. We can bring our sugars down, bring our cholesterol down, get out there and be more active. 40% of the stroke deaths, are male, 60% are female. So it's not something that needs to be taken lightly. Females obviously have higher risk for heart disease as well. So some of these are non-modifiable. You can't change who you are, your sexual makeup, but you can change, the reasons why you have high blood pressure, high cholesterol, why you have it's type 2 diabetes is very easily modified. Quitting smoking, whether you're male or female, you can definitely improve your lifestyle from that. So remember, stroke is the leading cause of disability in the United States. By modifying and educating our patients and our families and changing our lifestyle, we'll be able to continue to reduce these numbers, reduce the disability, and reduce the number of deaths every year from stroke. Hope you guys took in some good information. That's ready to have another great day in class.